In this video, I answer a question from a massage therapist in New York about why I don't use cupping in my practice and why I believe it isn't a useful treatment for addressing chronic pain. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a significant increase in flexibility, functioning, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so this question came from Adam. He's a massage therapist in New York. The question was, I enjoy all the content and information you put out to help providers get better results for their clients in chronic pain. But I noticed that you don't do any form of cupping and saw one of your older videos where you said you don't even consider it an effective treatment, which started making me question your knowledge on chronic pain. Have you ever taken a cupping course? I highly suggest you do so before you have an opinion on it all, because it has worked wonders in my practice for my clients, especially when added with corrective exercises. Thanks for the question, Adam. Just a quick reminder, I do love doing these types of videos. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, or if I think I can help, I'll get a video out to you. The information to submit your question is in our profile or wherever you're consuming this video. Just a quick thought on disagreements and shifting to questioning everything. I understand, these things are like, these are my opinions, these are my experiences, this is what I see. I'm not, telling you your kid is ugly or you're a horrible person. And we see this a lot in society where we might follow or learn from someone and they might have one different view and we're like, we're done with that. We don't want to hear anything they say. And I know Adam wasn't trying to be mean here, but he's like, hey, I kind of question your knowledge and integrity because you're questioning something that I do. I'm always open to interpretations and ideas and discussions. I think that's how we get better. Um, and I've gotten better in my older age. I'm 40 years old now, where I don't spend so much time like getting mad about stuff. I just have conversations. And usually, if someone insults you or gets mad or calls you names, they're not really living in reality. I wasn't saying Adam was doing this here. But I just wanted to make a little note on that. So, what is treatment in a musculoskeletal presentation? So, at the end of the day, when I talk about things and I'm talking in my context, I'm always talking about chronic pain treatment. That's what I do. That's what I'm an expert in. I treat chronic pain. People that have been lied to, overpromised, and underdelivered by the medical system, and just really want to get some natural and safe, effective results for their problem without having to resort to the traditional medical model, which just makes everything worse. So, treatment in the most easiest term is a successful reduction or removal of some type of pathology. Now, there's only 7 potential problems that you can have in a musculoskeletal injury, and that's what we do. Is that what we see as manual therapists? One can be a bone problem, one can be a cartilage problem, one can be a disc problem, one can be a ligament problem. You can have a nerve problem. You can have a soft tissue problem. I say muscles and fascia are included in there as well. Or you could have a tendon problem. These are the only 7 types of problems that you can have in a musculoskeletal injury presentation. And technical treatment of that is reducing or removal of one or more of those pathologies. So, what must treatment be? This is not my definition. This is a guideline from the FDA of what they consider to be a treatment. First, it's got to be safe. Does it cause harm? Next is it has to be effective. Is it actually doing something? And last thing is, does it have to be durable? Is it long lasting? It must be safe, effective, and durable. Next is just the idea of like correct dosage. If you do it and you get the dosage right, is it going to make a change in that pathology? If you do too much of it, is it actually going to cause problems. Next is this idea of cause versus effect. I think so much of the traditional medical model is we're so fixated on really just getting to the effect of, and a lot of that is like symptom based types of treatments and treating those things, but not really getting to the root cause of what's going on. And lastly, is just answering the question of why. Why is it happening in the first place? Why is the muscle tight? Why is the muscle weak? Why does the client have inflammation? Why does the client have pain? And a lot of times people just want to randomly just apply a treatment in there into the area that hurts in hopes of, just magically fixing the problem. So when I put cupping through that, the reason I don't consider it an actual treatment is the durability component. It isn't long lasting and it's really not getting to the root cause of what the problem is. Yeah, maybe it's getting helping to flush out the toxins, the inflammation, but why are those toxins and inflammation happening? Probably because there's an underlying problem that's not being addressed. So I'm not anti cupping. I'm not really anti any conservative treatment. I don't want to get that like reputation, but what I am is I definitely am against doing it with corrective exercises at the same time. This seems to be like a new fad that I'm seeing on Instagram and social media where people just load up an area with a bunch of cups and then they go through these movements and this corrective stuff. And be sure to take a picture for your social media so everyone can see how in depth and advanced you are. But the problem here is the corrective exercises are being done at the same time. The tissue isn't healthy yet. So a lot of times when you're putting the cups on there, you're temporarily allowing the pain to reduce, but you're not actually fixing the tissue. So you're actually exposing it. So I'm definitely against doing it with corrective exercises. And I know in the question, Adam's like, hey, when you add it with corrective exercise, it's like a game changer. I totally disagree. Um, it's not doing anything to actually fix the problem. It's temporarily making it feel better, but it didn't fix anything. And any treatment that only improves symptoms but does not improve function is actually dangerous. I'm also against doing it on the same day of treatment. I see this a lot where, people will, beat the hell out of the person, do a bunch of deep tissue work, stretching, everything, and then they'll throw some cups on it in the end. That's where that dosage is just getting too high. I think a lot of manual therapists make this mistake, and I did for years as well. Is we always think treatment can either go one of two ways. The first way is it can make the problem better. The other way is that it doesn't really do anything. We never consider that it can actually make it worse. Treatment is like a medication. You want to get the dosage right as well. And I think adding cupping onto a really focused and detailed treatment is actually counterproductive in the grand scheme of things in the dosage realm of what we see. I'm also against doing only cupping and not manually treating the tissue. There's some people that just do cupping, that's all they do. And they're like, hey, I'm getting all these amazing results. I'm like, are you really? How do you know? Like, how are you really getting that? I believe that as manual therapists, our job is to use our hands. That's what we're good at, touching, feeling the tissue. Cupping isn't actually doing that. It's not addressing the underlying problem, which I believe is dysfunction in the muscles and the tissues and the nerves, which need a manual based type of treatment. What I am pro cupping for is for cases with a big inflammatory response where maybe it's like a real chronic thing. Maybe they're like metabolically challenged and they just lay down a lot more inflammation. So this is what I would do if I did it. I would maybe say like treat it manually and then maybe later in the week have them come back and do the cupping to flush it out to help in the healing process. But like I said, when you're trying to stack it all in one visit, it's just too much dosage. It can really inflame some of those tissues. And a lot of these people that are coming with chronic pain don't just have soft tissue issues. They have issues with like the bone, the cartilage, the disc, the tendon, where there's degeneration in there as well. And just doing too much treatment can actually make them a lot worse. That's all I got in the video. I appreciate you watching. Feel free to share any insights you may have gotten in the comment section below. I try my best to talk to everyone, share information, learn from each other, and really make us like become a group where we can talk and have conversations without, name calling and stuff like that. If you know other providers that this might help, share the video with them. If they have a different perspective, they want to share something as well, or maybe I'm just missing something about the magical healing powers of cupping included with corrective exercise. I don't think I am, but I could be wrong, and I'm always open to have a different perspective and a different point of view. And lastly, if you actually like what I'm sharing, what I'm teaching, what I'm putting out there, you can go download our free training modules where we really take you through the idea of thinking critically, becoming a problem solver, being a master manual therapist, and solving and fixing problems that other people can't, and getting the reputation in your area as the go-to provider that fixes problems and helps people stay the hell away from pain pills, injections, and surgeries, which only make things worse. I appreciate you watching the video, and I'll catch you on the next one. Bye.